Hey guys, Michael here. This is a quick video on synchronized cardioversion. So, synchronized cardioversion is a method of restoring the normal rhythm of the heart in patients that present with rapid ventricular rates associated with severely compromised cardiac output. So, we have decreased blood pressure, we have altered LOC, we have chest pain, we have ultimately heart failure leading towards cardiogenic shock. So, synchronized cardioversion is indicated in the deteriorating ventricular tachycardia rhythms, such as ventricular tachycardia, supraventricular tachycardia or SVT, atrial fibrillation, and atrial flutter. There are no noted contraindications for synchronized cardioversion other than dysrhythmias in which the patient's perfusion is more than adequate to maintain level of consciousness. So the equipment that we require for synchronized cardioversion is we need a monitor that's capable of performing the skill. So we have here the LifePack 15, it's carried by New South Wales Ambulance. We have to have the compatible multifunction electrode pads that we have here, pacing and defibrillation pads. For the sake of this video, I've just placed some cling film so the pads might move a little bit, just to make sure that the mannequin doesn't get too dirty. We need to have intravenous access so that if necessary, we can sedate the patient if they are conscious. We also need resuscitation equipment, so we need our OPAs, our MPAs, have an LMA, BVM, ET tube as well. We have our suction, oxygen tubing, and as always, we have our PPE with us as well. Now, first of all, whilst we've got our PPE on, we now need to make sure that the patient is safe for defibrillation. We need to make sure that we're not on a metal surface, that the patient is not wet, the patient is not near water, and there are no flammable substances or free-flowing oxygen as maybe coming out of the BVM. They're all hazards and fire risks and explosion risks as well. So if the patient is conscious at this stage, we need to prepare the patient and identify the rhythm that's being displayed on our monitor here. So I'm going to explain the procedure to the patient, and that we're going to deliver a shock to the patient on the R stroke of their ECG complex, and this is hopefully an attempt to reboot the heart into a normal sinus rhythm. So we're going to position the patient supine. For ease for this video, once again, I just have the patient a little bit raised so we can actually see what's going on up here. We're going to ensure that the pads are on, that the view of the monitor is on pads. We're going to hit lead, we'll cycle through to pads. We're going to print a copy of the strip and the ECGs that's showing on there at the moment, and that's for verification further down the track to show this is the rhythm we had initially, and then post the cardioversion, here's the rhythm that we had afterwards. So we've exposed the patient's chest, and we've clipped the hair or dried the chest if necessary. We've removed any medication patches that may have been on, and we would have performed a 12-lead ECG at this stage, so we would have removed the dots that would have been on the 12-lead spots, but keep our 4-lead ECG dots on for monitoring. So we've gone for the anterolateral administration of the pads at the moment. So the upper right portion of the chest just below the clavicle, and then mid-axilla on the left chest wall. So once we've applied our pads, we've made sure that they've been applied in the correct place, and we obviously have the lead that's attached to the ECG monitor so that we can see the rhythm that's going to be produced by the patient. Now, following this, we want to check the ventilation equipment, and then any medications that we may want to use for sedation are at hand. So we have the syringes included for sedation over here. Now, first things first, what we're going to do is post-sedation, if required, or if not, we're going to press the sync button on the monitor. Now, if we hit the sync button, a sync marker or a small black triangle will display above each of the detective QRS complexes, and this indicates that the synchronizer is now switched on. Now, if required, we may need to adjust the ECG size, which is the button just above the sync button, and can be dialed in with the dial here, to make sure that the sync marker appears above the R wave of each complex. So now we've done this, we want to charge the defibrillator. So using the energy select arrows up here just underneath the on button, we want to select the appropriate joules. Now for adults, the first attempt is at 150 joules and the second attempt is at 200 joules. Now in pediatric patients, we go for a 1 joule per kilo rule. Now, once we've selected the joules, we then move into the actual cardioversion itself. So the defibrillator operator, which is myself, will press the charge button and the monitor will charge up. During this time, I'm going to say stand clear, charging. Once this has occurred, we're going to confirm the correct joules is shown on the screen and that the orange shock button is illuminated and continuous charge ready tone is sounding. So once we've done this, we need to do a final safety check, and the operator, myself, calls stand clear. So both myself and my partner need to visually check that no person has direct or indirect contact with the patient and engage eye contact with each other. We both close feedback, all clear from the patient. We're then going to hold the shock button until a discharge occurs. Now, once this has happened, we're going to reassess the rhythm that's shown on the screen. We're going to check the display. I'm going to run a hard copy so that we've got that once again, pre and then post attempt of cardioversion. If the rhythm does not convert back to a sinus rhythm and cardioversion has to be reattempted again, you have to make sure that you do press the sync button again to make sure that the indicator does fall on the R wave of each of the QRS. Complications that we might encounter with synchronized cardioversion are pain and discomfort if the patient is conscious or not sedated or has not had some procedural sedation for the procedure. Skin burns from the delivery of the electrical charge, inadvertent electrical shock to other people, bystanders and paramedics included. Defibrillation can cause myocardial damage, and a paradoxical asystole or VF, a ventricular fibrillation may occur. We are delivering a shock through the patient's heart. We want to make sure that we're monitoring this quite closely. We don't want any adverse effects going on, and if they do occur, we want to make sure that we're really prepared to approach this. So some key points for documentation in regards to synchronized cardioversion. You want to make sure that you're noting down the vital signs of the patient, particularly the ECG rhythm the patient presents in prior and post the administration of the shock. You want to make sure that you're also monitoring the vital signs. So the heart rate itself, you can see it on the ECG, but also the blood pressure of the patient, the GCS, the rest rate, the oxygen saturations, the whole global picture of the patient presentation at that time. You want to note the time that the shock was administered, the pad placement, whether you've gone for anterolateral or anterior-posterior, and as well as remembering that any sedation that you've administered, what drug it was, drug dose administered, time of administration, any adverse effects. Safety considerations both for the patient and for paramedics performing this procedure. You need to make sure you have your appropriate PPE, your gloves, your goggles, safety glasses. These are not appropriate, so I have my special glasses. Appropriate positioning of the patient. So you need to make sure that the supine, they're not near any water, open flames, oxygen, free-flowing oxygen rather, metal surfaces, metal objects, pipes that may be lying around. Who knows what we're doing these pre-hospital procedures. The risk of electrocution is very clear. It's very obvious. You need to make sure that you're communicating with your partner. I'm safe, you're safe, everyone else is safe. It's your responsibility to make sure that you're not going to harm yourselves. And you also need to make sure that, like I said, you may get electrocuted, but the patient is getting electrocuted. So if they are conscious and awake, you need to make sure you do use that procedural sedation. Make sure that they're sedated enough to, firstly, not feel it, secondly, not remember it. It's not going to be a very pleasant experience for the patient, so we're trying to avoid that as best as possible. Alrighty, thanks for listening.